are pressure ulcers. These are the ones you talk about being also known as decubitus ulcers or bed sores. I'm sure all of us have seen patients with bed sores, yeah, or pressure sores, pressure ulcers or pressure sores, bed sores. Yeah, so this one mostly occur over pressure points. And even when you see most of our patients, they tend to have a pressure sores or they tend to have bed sores around the sacrum, around the greater trochanter region. Yeah, I know you should be able to remember where the greater trochanter is. Those, they tend to appear in those pressure points. That is the place where the bone is not very far from the surface, and then you are in constant pressure in a hard surface for a very long time. So you end up with necrosis. Yeah, because the skin is compressed for long periods between a bony prominence and a hard surface. For example, a bed or a chair. Then, of course, blood flow to the affected area is impaired, and of course, ischemia may follow. And then if this is not dealt early, it may go on to become necrosis. And then, of course, the skin lodges off, you end up with an ulcer. And of course, there are different degrees of pressure sores or bed sores. You can even go up to 4th degree. By the time you're talking about 4th degree, maybe the bone is exposed. Yeah. So one of the way, of course, to try and deal with this for pressure sores, the best way is to prevent. And I know as nurses, you will deal with a lot of patients that you deal to try and manage this pressure sores. And I'm sure you've seen what we call Ripo mattress, for example. Right now in private wing A, that is the surgical private wing, we have a patient who has what we call a Ripo mattress to try and prevent pressure sores from developing. But I think the pressure sores are there, but you want to prevent it from becoming deeper. So one of the ways to try and reduce pressure using those mattresses, those Ripo mattresses that we use. So some of the factors that predisposes somebody to develop pressure sores, which are very difficult to treat. Once it has developed, very difficult. So the best thing would be to prevent. So for those of us, because we are basically nurses, is to try and prevent these pressure sores from developing, because once they develop, it's very difficult. So if you know the predisposing factors, you try to deal with these factors and prevent them from causing more harm, probably, if you can. So some of the things could be extrinsic, that is from outside the patient, like pressure, shearing forces. So things like even when you, the type of the pillow that they use, the type of bed sheet that they use, the type of mattress they use. So you want to reduce shearing forces, you want to reduce trauma, immobility. So if the patient is not able to move, is not mobile, and they're always sleeping, then they will sleep on one place for so long, pressure will occur. That is one of the predisposing factor. Moisture. For example, patients who are not able to move, elderly, and they cannot move out of bed, sometimes they may urinate on the bed, they pass stool on the bed, so the whole area become moist or wet, and that itself predisposes to pressure. So one of the things that you do maybe as a nurse or even as a doctor is to try and ensure the beddings are dry. There is no moisture around it. You prevent, maybe you put a catheter so that they don't urinate and make the bed moist. You have to deal to prevent this moisture. Infection also. So if there is infection, there is likely to predispose to development of pressure sores. And then there are some that are intrinsic. Intrinsic is coming from inside, inside of the body in this case. For example, poor nutritional status. If the patient is malnourished, that is something from the patient that is intrinsic. So you try to deal with, so you ensure these patients have a nutritional review so that nutritionists can give them food that can be able to build their body to prevent malnutrition. So if the patient is emaciated, that is, they've lost a lot of weight and so on. Generally, somebody who is emaciated, there tend to be a lot of prominence of, for example, the greater trochanter, prominence of the sacrum and other places. The bone become more superficial, and so there is higher risk of them developing pressure sores. Incontinence, as I've said, if their patients are incontinent, they are not able to control urine, so they are urinating on the bed and so on, or they are not able to control a stool, then the whole place become wet and so on, and so they are predisposed to get pressure. So also, if they have infection in the body, for example, maybe they have pneumonia or other infection, then it increases the risk of them developing pressure sores. Concurrent illness, if they have other illnesses, Maybe they are diabetic at the same time, they are maybe hypertensive, or they have other illnesses, then that tend to increase the risk of them developing pressure sores, pressure ulcers. Sensory impairment, that means their sensation is impaired, so that they are not able to feel pain. For example, in patients, for example, who had diabetes for long that is not with well control, they tend to develop what we call peripheral neuropathy. They don't have good sensation. So even if they are injured, they don't feel the pain. And so they end up developing pressure sores without knowing. Also, poor circulation, that if they don't have enough circulation to a place, so healing become a problem and they're likely to develop pressure. So it's important. So for pressure sores is something we always manage, and they will always be in our wards. This patient with pressure ulcers will always be there. So the best thing probably will be to prevent. Right from home, where the patient maybe is not mobile, you teach the relatives how to regular tanning. So one of the things that we do in this pressure source, we do regular tanning. You use those things like Ripo mattresses. You ensure the nutrition is good, and you treat any infection that may be there. You try to make sure the bed is not full of moisture. You deal with the incontinence if it is there. You deal with infection if it is there. Yeah, and of course, this is something you'll always deal with, this pressure source, and they will always be, for example, in surgical ward. So I think we end there.